Okay, welcome again in VuMedi, and thank you for inviting us to present the MUS1 randomized clinical trial, which has been presented as a late-breaking science at TCT 2025. I'm presenting these data on behalf of our team and the PI Rima Chaddad. So we know about the importance of music and its influence on our behavior. That's sure. But historically, there are also reports on the usage of music to increase and improve the sports performance. And this is something that was applied in the old Tuscany at the time of the Etruscans. But if you want to apply the effect of music during a complex percutaneous interventions, literature is so far scarce. Which is the background of applying music in the cath lab? So first of all, PCI provokes some stress on the patient, and this stress is psychological but also physiological. There is an increase in the sympathetic tone, in the cortisol release, and there is an increase in the blood pressure and heart rate in many of patients. And our patients also exert a high anxiety level, which is usually taken care by drugs with opioids and anxiolytics, which are associated with poor outcomes. So music therapy is an affordable patient-centered intervention that has shown already in other applications of medicine like cancer treatment, radiotherapy, and psychiatric disorders to have a good performance by lowering the anxiety, increasing the tone, the parasympathetic tone, decreasing cortisol, and decreasing the sympathetic tone. There are some initial and small studies, unpowered studies, to test these effects in the cardiovascular patient, but so far nothing has been powered. So this is why we wanted to go with this randomized clinical trial, which has the patient in the centered into our goals of providing him or her the best music approach. The best music approach has been applied by music therapists, which tailored the compilation of music according to the preferences and the historical background of the patient. So I'm talking about this team of physicians and music therapists and coordinators that helped us and supported us in doing this first study, which was enrolling patients in Paris. So the hypothesis is that the music therapy, personalized music therapy, reduces hemodynamic and biochemical stress for patients undergoing coronary interventions. Primary endpoint is a post-procedural mean systolic blood pressure, where we expect a reduction after music therapy. And we also have secondary endpoints with some cardiovascular parameters, heart rate, saturation, diastolic blood pressure, BNP, cortisol, and troponin. Statistical analysis, we performed this randomized clinical trial hypothesizing a reduction in a systolic blood pressure by 80 millimeters of mercury after music therapy application. So this is why we calculated the population of 100 patients with the randomization 1:1:1. So the first group did listen to music only 30 minutes before. Group 2, Group B, listened to music before and during the procedure, and Group C is just standard of care. 104 patients have been enrolled and randomized into this study. These are the main baseline characteristics, which show no differences between the several groups. And these are the baseline parameters. Again, no significant differences for blood pressure, heart rate, saturation, BNP, troponin. We also had administered an anxiety and a STI questionnaires, which was prepared by our psychiatrist before. And you can see here that the anxiety actually was lower in the control group as compared to the two music therapy groups. And this is the type of music played, which, as I emphasized earlier, was tailored according to the preferences of the patient and according to the performance of several questionnaires by our music therapist. So we delivered opera, jazz, pop, nature, and classic music in the 2 treatment arms. Primary endpoint actually did go well in the music therapy, but only in group B. Group B is the group where we deliver the music before and during intervention, whereas there was no effect on the music in reducing blood pressure if the music was applied only before the intervention. So if we see these, we can see that the primary endpoint of the study was actually met by a significant reduction in the systolic blood pressure by music therapy application. And same thing is for heart rate. Heart rate was significantly reduced by music therapy during the intervention as compared to music therapy before and as compared to music therapy or no music therapy, so the control group. No differences for the saturation and no differences for the intraprocedural complications and arrhythmias so far. But the anxiety level was significantly reduced by music during the intervention. Heart rate was significantly reduced, and interesting and probably hypothesis generating, also troponin release was significantly reduced by music therapy. But again, these will be assessed in further studies because it's only hypothesis generating. So this is the first study, randomized study in this segment, and gave us a lot of information which are allowing us to plan the future of music therapy in the cath lab. So this is why we have planned the MUS2 randomized clinical trial, which is another investigator-driven by Fondazione RIC multi-center international trial, which will enroll patients undergoing PCI, with music therapy delivered just before and after the procedure. So we are canceling the first group of music therapy just before the procedure. And we are developing a dedicated app which will take care of the patient from the beginning to the end of the procedure. So this app will have a video tutorial showing the hints of the characteristics of this study. We'll collect basal parametric data about the patient. We'll collect the questionnaires by the psychiatrist and by our music therapist. And then we'll record all of the cardiovascular parameters that we will apply during the procedure. Then it will randomize the patient. It will allow the tailored music therapy according to the group of patients and after the randomization, and will collect all of the data of the CRF of the patient afterwards. In conclusion, the findings of MUS1 randomized clinical trial support a tailored music therapy as a safe, affordable, and effective non-pharmacological intervention to reduce cardiovascular stress, pain, and enhance the overall patient experience during coronary interventions. MUS2 randomized clinical trial will delve into more details about the effect of music on troponin, cortisol reduction, and a possible reduced need for opioids and anxiolytics in a cath lab during percutaneous intervention. Thank you for your attention.